Hello, I'm Dr. Luca Bartolini. I'm an attending pediatric neurologist at Mayer Children's Hospital in Florence, Italy. I am joined today by Professor Renzo Guerrini, head of the neuroscience department, to share highlights from our recent article in Developmental Medicine and Child Neurology on the diagnosis and treatment of occipital brain lesions in children. These lesions are important because they often affect vision in ways that can be subtle and difficult to diagnose. One striking example is visual agnosia. This is when a child can see but cannot recognize objects. They may describe shapes or colors correctly, but fail to name or use familiar items. Recognizing this unusual presentation can be a crucial clue. Now, let's start by discussing some of the key aspects of the differential diagnosis and imaging features of these lesions.
Thank you, Luca. We have some examples here on the first line, A, B. There is a child with a posterior reversible encephalopathy syndrome. You can appreciate high signal intensities on posterior brain areas, especially the right occipital lobe. On the second line, we have another interesting example, is a child with acute disseminated encephalomyelitis with bilateral high signal intensities in the white matter, which involve both parietal and occipital lobes, and even the posterior part of the frontal lobes. On the third line, we have an example of a 7 Tesla imaging of a 11-year-old child with focal cortical dysplasia involving the left occipital lobe, as the arrow shows. On the fourth line, on the G and H, we have a child with a form of Polge syndrome, which is a severe form of mitochondrial disease, which tends to involve the occipital lobes and cause a severe form of epilepsy related to these brain areas. You can appreciate here that there is a bilateral involvement, which is more severe on the right, on the G figure. And then on the last line, which is the fifth, we have the I and J figures. And this is a child which is now grown up, is actually an adolescent with what is left by a neonatal hypoglycemic syndrome. And there are two lesions on both occipital lobes, which is less severe on the left and more severe on the right. And the FLAIR images show it very, very well. Now, I must conclude by commenting that our interest in these conditions and the idea of gathering them together for a review came after the observations of these children coming into the clinic in a condition of agnosia with prosopagnosia, which is the difficulty in recognizing faces, in recognizing non-familiar environments. And some of these children were really lost in these unknown environments. This situation needs a differential diagnosis, and I think that now Luca will provide you with some specific details about this process.
Thank you, Renzo. Moving on to the next slide. One of the central challenges we discuss in our paper is distinguishing central visual impairment, or CVI, from other common conditions in childhood, such as ocular disorders, developmental delay, or attentional problems. Table 3, which is shown here in the slide, provides a set of targeted clinical questions that can guide this process. For example, does the child's vision improve in familiar versus unfamiliar environments? Do they have difficulty recognizing faces or objects despite apparently normal acuity? Are visual behaviors inconsistent from day to day? Do they show unusual visual responses, such as looking away from rather than at objects? These kind of questions help clinicians identify when the issue is cortical and not ocular, and when further neurological evaluation is needed. A detailed neuropsychological evaluation can then help further refine the central visual deficits in these children. In summary, our article emphasizes that the differential diagnosis for occipital lesions in children is broad and that recognizing signs like visual agnosia and asking targeted questions about visual behavior can be decisive in reaching the right diagnosis. We hope our structured approach will help clinicians pick up subtle cases earlier and initiate treatment and rehabilitation that improve long-term outcomes. Thank you for watching. We invite you to read the full paper in Developmental Medicine and Child Neurology. Thank you,
Thank you.
Professor Guerrini.
Bye. Thank you. Bye.